Hi, welcome to the Woman to Woman Show. We're here today to talk about something that, frankly, in Oregon, we have to talk about. I'm here with Dr. Bill Toffler, excuse me, putting on my glasses here, who is National Director of Physicians for Compassionate Care and Professor of Family Medicine at OHSU. Welcome to the show, Doctor.
Well, thank you very much, Luann. It's great to be here.
Well, thank you. You know, driving in today, I couldn't help thinking, I can't believe I'm coming to talk about this issue. Physician-assisted suicide has been a reality here in Oregon for a number of years.
10 years.
10 years,
The 10th
okay.
year anniversary was just yesterday.
Okay. If you would just kind of give an overview for the people out there that may be kind of confused, they've kind of heard it and kind of not, and they really don't know Suicide Oregon Legal, what is it all about and how does it affect me? If you could kind of bring us up to date and go back and say, what is the law that passed?
Sure.
What does the law say that you can do? And what motivated you then to start Physicians for Compassionate Care and oppose this?
Sure.
Okay.
Well, assisted suicide is legal in the state of Oregon, and it has been since the initial law was passed in 1994. It was held up in courts for several years and then ultimately was released from the courts as being a reasonable thing to do from a legal point of view. And so we're now carved out as a separate state, apart from the other 49 states, where I'm empowered as a doctor in the state of Oregon to give a massive overdose of barbiturates to some patients under whatever arbitrary circumstances. And in '94, we were caught off guard. I don't think anyone in their wildest dreams imagined that it would really pass, that people would embrace the situational killing of people who are labeled terminal. You know, as though they should be treated differently than the rest of us, who, by the way, also are terminal. We're all terminal.
We're all 100% of people do die.
Well, indeed.
Last we heard.
And the ability of a doctor to predict, as though we have a crystal ball reading course in medical school. And I teach in medical school. We have no such course. And in fact, the studies show that doctors are really poor at being able to predict exactly when someone's going to die until it gets to be within the last 2 weeks. In fact, it's a lot better if it's within a few days that we get more accurate. But beyond that, everyone has a story about a doctor having said...
They sure do. I've got them in my family.
My mother was told she only had 3 months to live, and it's 17 years later. It shows the arrogance, the chutzpah, if you will, of some people who believe that someone's life is going to imminently die, and define imminent. In the state of Texas, imminent means a year. So in our state, we now have an empowering of doctors as a carve-out, the only government in the Western Hemisphere that does this. And the good news is that we in Physicians for Compassionate Care and other groups have tracked and monitored the problems that have leaked out, emerged from underneath the shroud of secrecy that envelops what's really going on in Oregon. And we've educated other states, as we did just a few weeks ago in the state of Washington, where one of my colleagues, Dr. Ken Stevens, and I had gone with groundwork to educate doctors. So the Washington State Medical Association soundly rejected assisted suicide or going neutral on it.
They were a little smarter.
Which is kind of, exactly.
They were a little
The
smarter.
first step in Oregon was exactly that, trying to get the doctors to be neutral, meaning that get them out of the way as leaders and guides to society about what is ethical as a standard in the practice of medicine.
And I don't know how many people remember, and I didn't save a copy. It's kind of a historical document, I guess, of the original ballot measure, but I remember it had wording that made me really, really upset, because didn't it have something to say, if I remember correctly, should terminally ill patients be allowed to blah, blah, blah. Well, the first thing you read is, oh my gosh, a terminally ill person, that should be allowed to do anything, the poor things. Isn't that how they did it?
That way, as well as the euphemism, death with dignity, the so-called death with dignity. Well, I believe in death with dignity.
Who wouldn't?
But I don't believe in empowering doctors to give massive overdoses to kill patients. That's a different story. And if you had people clearly vote on the King's English rather than the euphemistic ballot measure, which encaptures this image of can terminal people decide to do what they want. Well, they have that power in every state. I mean, people can end their lives and in fact do. In fact, in Oregon, we have a task force because we're among the league leaders in suicide, just plain suicide. Of course
we are.
We're the fourth. and the people who advocate for assisted suicide say, oh, well, that's not the same thing. Well, if the mentality is that if life gets difficult, it's okay to end your life, that is extant, then why would you question that somebody who's in their 30s would end their life.
Well,
you teach them the solution to life's difficulties
it's
is to end
cheapening
your
life. And let's go back to this measure that passed. They talk about, oh, it's just under these really, really rare circumstances. It's just, it's not going to be a big deal. Tell exactly what the provisions are for this.
The so-called safeguards are that you have to be a resident of Oregon. And of course, how do you define that? It's not defined in the Act.
Okay.
Of course, I suppose
it's not
that
defined.
means
I can be staying with my friend.
And I say I'm a resident of Oregon. And I have an address, and you're now a resident. You could register to vote using that same address.
Yeah.
You can get a license by saying the same thing. So we already know of cases, they've already been written up, of people who've come to this state from other states. Now, of course, that's not in the Oregon Health Division's records or the Department of Human Services because they don't ask about that. They just they use an address and they're able to come here. So it's already been recorded, and this was done by Dr. David Jeffries, who actually interviewed many people who, by the way, are promoters of assisted suicide. He specifically asked people who don't feel as I do, and these are the facts that he found and were published in his paper that he wrote under a Churchill Scholarship, or Churchill Fellowship from the UK. So it's very credible evidence to shows that there are many things that are outside of these so-called safeguards. So residence is the first thing.
Okay, so they say you got to be a resident.
Then you have to request it. Orally, you have to put it in writing, and there have to be 15 days apart between two separate requests.
Okay.
And then, of course, they have to have a second opinion. And now there's a network of people who are very much active promoters of assisted suicide.
Oh, yeah.
Not the majority of doctors. There were 40 who wrote prescriptions last year, and there may be 50 or 60 out of the 8 to 10,000 active practicing physicians. I was just going to say how many practicing, 8 to 10,000. Now, many doctors are either tacitly supportive of this or neutral, but there are only a handful that are active, and so much so that some of my colleagues, some of the people I work with, have attended 8 deaths. Now, if you think about that, with a denominator of thousands of physicians, the chance that any one doctor would attend 8 or even 40 deaths, as some of them have done, then you know that they really are sort of specializing in developing a thanatology practice, a practice
of... that goes on their business card? I don't know. I specialize in death. I don't know.
I think there should be an openness about that. I mean, I once had someone from the ethics
selling point
ethics center at OHSU come and say, well, maybe Dr. Toffler, you don't do certain things. Let's put a sign in the office so that people will know, and they won't be bothered because you don't. And I said I did too. In fact, it's such a good idea. Why don't we put a sign up for all the doctors about what they do and they don't do?
I agree.
And that would be transparent, and I think that would allow patients to know who are they actually seeing. What's the philosophy of the doctor? Do they do abortions? Do they do assisted suicide?
Yeah.
And if they do, is that the doctor you want?
Instead of not made in China, it's not going to kill you. I like that.
And the point is that, this isn't a progressive idea. It's actually recapturing an idea that was alive and well 2,400 years ago.
Wouldn't you think? Yeah.
And that's why there was a Hippocratic tradition saying this is an inherent conflict of interest. You'll often hear, Luann, it's those Christians imposing their morality.
Oh, yeah.
Well, 2,400 years ago, it was a pagan era. There was no Christianity.
I think that's great to bring that out.
And they basically had recognized the inherent conflict of interest of healthcare professionals giving hemlock to patients. Somehow we seem to have failed to study our own history as a medical profession.
Well, we know it's being rewritten.
In Oregon, we are definitely distinct than the other 49 states. We've managed to educate the physicians and the people of Michigan, of Vermont, of Hawaii, of Washington, Alaska.
And they're not going for it.
In California, most recently. In fact, they're meeting this weekend, again, with the promoters of assisted suicide, trying to get the doctors to be neutral, which then the papers would... Los Angeles Times would say doctors would have shifted their position on assisted suicide.
Yeah.
And that's the first step to desensitizing the voters. So if the doctors don't have a sense of this being ethical or unethical, then it's okay.
Well, unfortunately, we've got the law. Now, we need to convince people there's more to find out about this. And are we ready for the tape? Is that what we're ready? Okay. I want to show a video, and then I kind of want to talk about what we're seeing. It's an older one, and you kind of got to get past the older outfits, but I think it has a good message, and I think we're able to watch that.
We don't do this alone. We can only do it with the help of other people.
Dignity is connected with his conviction that life counts.
I will do nothing that will contribute to the death of an innocent human being.
We did not volunteer for this. We certainly wrestled with God over it in many different ways. We learned a lot from it. We learned some basic things like God is sovereign.
Steve Earle and his 2 teenage daughters have lived through a dramatic event that most families will at some time face: the death of a loved one from a terminal illness. Rachel Earle, their beloved wife and mother, was first diagnosed with cancer in 1991. She passed away in the summer of 1997. Most of us realize that at some point in our lives we will lose a loved one to illness, and no one wants to see their loved ones suffer needlessly. So many Americans are being drawn towards physician-assisted suicide and euthanasia, believing them to be compassionate responses to end the suffering of dying people. However, most Americans are uninformed about the darker side of assisted suicide and euthanasia. Should physicians, who traditionally play a healing role in society, be allowed to intentionally take part in a patient's death? What impact would legalizing euthanasia and assisted suicide have on healthcare delivery? Could patients who want to live be coerced into dying? And what does the Bible have to say about life and death decisions like these?